And last night, I read through all of your statements beforehand. And if I could, because there's been a lot of questioning, of course, about on the testing side. And Ms. Campbell, if I could turn to your testimony. On page 2, you said in recent years that CGI Federal has delivered some of the most complex IT implementations for the U.S. government, including federalreporting.gov and Medicare.gov. And we've heard from you all saying that, you only had, at the very end, about 2 weeks to really make sure this thing was integrated. When you were working on, let's just say, for example, Medicare.gov, how much testing did you do on that? Did they give you a time frame, or what can you tell me about that testing at that time?
I'm sorry, I can't give you the exact time frames, but we had sufficient time to test the system before it went live.
Okay, could you tell me what sufficient time is?
So we had, a number of months before the system went live.
Okay, if you could, by tomorrow morning at 9 o'clock, I'd like to get that information from you to find out exactly how much time you did specifically have to test that system. What about on federalreporting.gov? How much time were you given to test that system?
I'd have to get back to you. That wasn't in my
okay.
my area.
We'd like to have that by 9 o'clock tomorrow morning, so we can get that information. And I think I heard this earlier. Is healthcare.gov the most complicated of the systems that you've created?
It is by far, for our country, one of the most complicated large-scale systems that it's out there today.
Okay, and so what you've been telling me, you've had months versus a couple of weeks to do that testing. And let me ask you this. Did they, when Medicare.gov or federalreporting.gov, are you able, especially on the Medicare side, because you say in your testimony, which successfully helps more than 50 million U.S. citizens compare health and drug plans each year, is it set up the same way that healthcare.gov is, that you first have to register before you can browse, or can you browse then and get what you need?
You can browse first.
Okay, now why would those two systems be different then? That you'd have any reason that was given to you by CMS or HHS that they wanted it reversed, since the one system seemed to be working?
I do not. CMS, I guess, had to speculation, number of priorities, and maybe that wasn't one of the priorities.
Okay. Mr. Slava, if I could ask you a couple of questions in your testimony. Again, I found all your testimony all very interesting. And it's been talked about a little bit before, but in your testimony, you stated on page 4 that it appears one of the reasons for the high concurrent volume at the registrations was a late decision requiring consumers to register for an account before they could browse for the insurance products. Again, whose decision was that?
We don't know.
You don't know whose decision that was? How did you get the information that you were supposed to do that?
I'm sorry, can you repeat that?
How did you get the information that you're supposed to switch things around like that then?
One of the testers in our company that was responsible for testing the CGI software code was notified that there was code they no longer needed to test.
Okay. Well, if we could also by 9 o'clock tomorrow morning get the name of the individual from CMS that asked for that, we'd appreciate that. Going on in your following up a little bit on your testimony on page 4, again, it goes back. It says, in our role as tester, we were tasked with identifying errors in the code that was provided to us by others. We reported the results back to CMS and the relevant contractor, who was in turn responsible for fixing the coding errors or making any necessary changes. Do you know who that was back at CMS that you were supposed to report back to?
I don't.
Okay, if we get that by 9 o'clock tomorrow morning. Do you know who that relevant contractor was that you were also supposed to be getting that information to?
CGI.
I beg your pardon? Okay.
CGI.
All right. And when you submitted that information back to CGI, did you hear back from them, or what happened with that information that you sent them?
So I don't know what happened in every case, but what typically happens is we submit the results back, and then the other contractor is responsible for making those changes.
Okay. Thank you very much, Mr. Chairman. I see my time has expired. Thank you. I yield back.